Me wrong on the time. I appreciate you. Welcome to our second hearing for 2016 of Budget Subcommittee number 3. We are going to do something slightly unorthodox to accommodate the needs of a committee member. Senator Mining is en route, but I'm going to call the hearing to order in that Senator Stone is here. Senator Stone needs to leave, and so I'm going to open the rolls on our 3 vote items. I'm going to leave them open so Senator Mining can add on. We unfortunately won't have time to hear the presentations on these vote items. I think what I'll do is I won't vote. We're going to open the roll just for your vote. Hear the presentations, mine and I will vote. Fair enough? Senator Stone says he doesn't have any questions on these items. He's already reviewed the materials. So I'm going to begin and open the rolls on item 0530, issue number 1, the BCP Appeals Case Management System. Call the roll.
Senator Mitchell, Senator Monning, Senator Stone.
Aye.
It's one aye vote. We'll hold that open. The next item we're going to take a vote on today is file item 5180, issue number 11, BCP Raising Cal Fresh Children's Enrollment. That can be found on page 32 of your agenda. Please call the roll.
Senator Mitchell, Senator Monning, Senator Stone.
No.
That's got 1 no. It will be held open. Item 5180, issue number 12, TBL 617, defining CalFresh contracts as cooperative agreements. Please call the roll.
Senator Mitchell, Senator Monning, Senator Stone.
Aye. Thank you, Madam Chair.
That has 1 aye vote. Thank you, sir. Again, today's hearing will focus on health issues and will cover the various issues at the Department of Social Services, including state hearings, CalWorks, and CalFresh. We have several items up for vote, which we'll be taking them up once we hear the presentation. We will take public comment after each agenda item, so members of the public should be prepared for that, unless, as we go through the course of the hearing, I begin to group things together just because it makes sense in terms of the presentation. With that, we welcome all of you here. I appreciate your participation and your attendance, and we'll begin by inviting the Department of Social Services up for file item 5180. Yes.
Good morning.
Good morning, Director Lightbourne. Thank you for coming. We're going to start with the overview, and we appreciate you being here. Thank you, sir.
Thank you. And of course, I'm joined by Chief Judge Manuel Romero of the State Hearings Division, and I'll turn it over to him to do the SHD presentation.
Good morning, Madam Chair, and good morning, Senator Stone.
Morning.
My name is Manuel Romero, and I am the Deputy Director and Chief Administrative Law Judge for the State Hearings Division. I'm going to zero in and focus on the questions that were in the agenda.
Excellent.
And address those. And as I address those, I hopefully get you the information you need, and of course, here for any questions you may have. The State Hearings Division is the entity that provides hearings and issues decisions for programs under the Department of Social Services. Historically, we have done that for a long time, and those programs include programs under CalWorks, CalFresh, IHSS, foster care, including adoption assistance program. And then by interagency agreement that has also been in place for years, we have provided the hearings and the issue decisions on cases, Medi-Cal cases from the Department of Health Care Services. And then, of course, in October of 2013. We also became the appeals entity for the new program, Affordable Care Act, that was adopted and implemented in California, and we've been providing the hearings and the issuance of decisions of appeals from the Affordable Care Act program since that time, and that is the focus, of course, of today's request. But before getting there, I'll talk a little bit about the penalty structure and how it is that that operates. The division has been, since 1987, under 2 court orders that require payment of penalties for late decisions, and programs that are covered include all the programs that are administered by the Department of Health Care Services, all the Medi-Cal programs, and then also the Department of Social Services programs, with the exception of community care licensing. But all other programs are subject to the court order. We are under a penalty structure that calls for a penalty, a minimum of 5 days, $5 to be issued for a case that may be late, all the way up to $100 per day. And the way the structure works, it includes a 95% threshold, meaning that if we are over 95% in any given month in those areas that we're responsible for under the court order, we don't incur a penalty. If we're below 95%, we do incur a penalty, which is at the rate of $2.50 a day for each day that we're late. For each month that we're late. And this is where the stepladder effect that I describe every year comes into play. So to get to $100, it takes a while. It's $250 a month if you don't have reach better than 95% timeliness. And then to work yourself down is also $2.50 per month to get you back down to $5 a day. And that brings the question up of how are we doing since we received the resources both in 2013 as well as the resources, limited term resources that we received in 2014. And the good news is that we have made substantial progress in reducing the penalties, and that we have making very good progress and also meeting the 95% timeliness. And we provided a chart in the PowerPoint, but the numbers actually, when you look at them, by fiscal year, when you see the point that they were the highest in, fiscal year 11-12, there were 1.1 million. In fiscal year 12-13, there were 4.4 million. We then, with the resources that we started getting in 2013, were able to bring those down progressively every year, so that the total went to 595 in 13-14, 240,000, a little bit over 240,000 in 14-15, and we're projected to be at 55,980 by the end of this fiscal year. And the key to being able to continue that is to have adequate resources to meet the 95%. That is the key. If we don't meet the 95%, then we do get into significant issue with respect to penalties. And the reason that the rates are different in terms of where we're at with the specific programs, CalFresh and CalWorks, we actually started at a rate of $60 for CalWorks and $32 for CalFresh in 2013. We were able to meet that $5 a day because we were able to stay current with them, but we were at $100 a day for IHSS and Medi-Cal. So we have made significant progress in bringing that daily rate down at this point. So we're now at $62 and I believe 49. I have that also, $47.50 for Medi-Cal and $57.50 for IHSS, down from $100 from July 13th. So that is significant progress, and again, that's a direct result of having gotten both the allocation we did in 2013 and the allocation for limited terms to be able to handle the Affordable Care workload so that it would not adversely impact the increase that we had. as a result of taking on that workload. Question 2 asks, please describe the types of the majority recipients are requesting hearings on, the type of cases. So we focused on the Affordable Care Act because that's what we assumed that the question was pertaining to. So over 70% of all of appeals under the ACA are for denials. The total appeals for the discontinuances are at 11%, and total appeals for eligibility determinations are at a slightly over 18%. What that means is that the eligibility determination is a category of cases that come up after the open enrollment period has passed, and if a person who's seeking coverage didn't apply doing that, then they apply in what's called a special enrollment, and then they have to show that they're timely in special enrollment. So the denials usually is because they haven't met the timelines, and that's why you see such a smaller rate of denials in eligibility determinations during the special enrollment period. I can give you breakdowns in terms of Cover California numbers. They're pretty much mirror the overall numbers. Cover California only cases are 38%. Cover California and duals are 49%. And Magi only cases, which are the county's only cases, are 13%. So that's how the Affordable Care Act appeals are breaking out. We do have only a 2-year experience, obviously, with it. And the proposal, I'll go to the other two. If there's no questions on this piece, I'll go to page 6, which was the other 2 questions that are being asked.
I have a quick question. Do you have your, I appreciate you sharing giving us the data with regard to Affordable Care Act. Do you have similar data with regard to CalWORKS with you? Just because I'm curious, when I took a look at the CalWORKS annual summary that was released this past January, it identified in 14-15 there were about 200 some odd cases that were denied. And I'm just curious because that strikes me as a number of people who were applying for aid that aren't getting it for one reason or another. Do you have a sense of what's happening in those cases? Are the denials typically correct? Where are we?
I do not have that information to share with you today. I do have the total number of CalWORKS appeals that we received. I can provide you that.
Please.
And that number is for 14-15 was 15,942, and for 15-16 it was 16,739. But in terms of the breakdown for denials and grants, we would have to go back and do a pool for that information, but we can provide that.
I would appreciate that. Thank you. So, and now let's proceed to the next question.
Okay. The next question was to briefly summarize the proposal. So all the cases that are not Affordable Care Act cases, we refer to as general jurisdiction cases. That's all the CalWORKS, CalFresh, IHSS, Medi-Cal, except for the Magi Medi-Cal, which is part of the Affordable Care expansion. And the proposal seeks to address what amounts to a 55% increase from 2013 in our overall workload. And we are seeking conversion of 56 limited term positions to permanent status and permanent funding. And we're also seeking permanent funding for 2 existing positions, which is one is an ASA and another one is an office technician position, for a total of 7.2, a little bit over 7.2 million, and then of that 1.8 million in general fund. And at this point, our estimates in terms of what we based these numbers off, and was there in the question number 2, which asks what is the difference of the current estimates from the original estimates, and how have they changed from those original estimates. The original estimates, we didn't know. We didn't have really any idea what the landscape was going to look like, and so we did rely at that point in our own historical data for the rest of our workload. and the rate of appeal based off of those, that historical, which generally is represented a 2.5% rate of appeal when you look at programs, the total populations that are in a program. And we applied that same ratio to determine the projections back when the program initially started. Now we have 2 years of experience under our belt, so we refined that, and when we did that, we have a less than that rate of appeal, and that's the reason that our current request is for the total of 58 instead of the total of what we asked for was 63. So it's 7 positions less, but that takes into account that adjustment in the estimate. Having said that, we're closely monitoring this because this is still an evolving landscape, and we still don't know where everything will land. And an example of that, we have already seen an increase in our scope of benefit cases that we have always done historically under Medi-Cal, but the expansion of 3 million additional folks into the Medi-Cal roles now means that they have the right to appeal whenever there's a disagreement or dispute over the prescription they're being given, a medical device they may need, a medical treatment that they're seeking. And so that has resulted in over 80% increase in the hearing requests and scope. So that's, and we've accounted for that in our estimate. The other piece is redeterminations or MAGI redeterminations. The counties have not yet gotten around to really performing or conducting redeterminations of folks who are now receiving MAGI Medi-Cal simply because of the implementation issues that came up with respect to rolling out the program, and a couple of lawsuits where folks were determined to be provisionally eligible, and that provisional eligibility is still in place until the counties can have the capacity to begin that redetermination process. We accounted for that redetermination workload as well in the projections that we made here. So that is still uncertain, and so we may be back, but at least for now, and based on what we're seeing, this is what our request is. Good morning, Senator Monning.
Any questions you have, Senator Monning? They've presented kind of the overview, and we've moved also over to issue 2 on page 5 of the agenda, which is the budget change proposal request.
Thank you, Madam Chair. No questions.
Excellent. Finance or LAO? Any comment on issues 1 or 2 within the Department of Social Services? Any public comment? Seeing none, we'll hold those items open.
The next one, okay, so it also involves our ACMS, and my partner and colleague from OSI is here to make that presentation, Cynthia Tosher. She'll come up and.
Excellent. So we're moving on now to item 0530, issue 1, under the Health and Human Services Agency, and it's the budget change proposal regarding appeals case management system. And this is a vote item. Page 7 of the agenda.
Excuse me. Hold the chair forward. Okay, good morning.
Good morning.
My name is Cynthia Talker, and I'm with the Office of Systems Integration.
Sorry.
It's okay.
I always call her Cynthia, so that's the way it came out.
And I'm a Deputy Director at the Office of Systems Integration, and I'm here to speak with you on the appeals case management system. So the 2 questions, one was a summary of the proposal, and then explain the proposed timeline. So as a background, ACMS, appeals case management system, is the project to create an integrated case management system to meet the business needs of the State Hearings Division. With that, we are currently in an active procurement. That's where we are. And we are currently working with the California Department of Technology on an SPR to get that approved to modify total project costs and to modify the project schedule based on things that have occurred in the last year or so. So the specific proposal is to request the approval of 7 positions from limited term to permanent. That is to assist Office of Systems Integration in its recruitment and retention of skilled personnel. Limited terms are very difficult to get qualified, not I want to say qualified, but, to get candidates who will stay,
Right.
So we are using this to do that. And then, as we discussed, they will, when they're no longer needed on this project, they would move to another project where their skills would be utilized there, either through DD&I or M&O, based on the skill sets.
And could you talk a little bit about how the timeline has changed?
Thank you. Going back to the SPR, thank you. So right now, we have had some modifications to schedule, and some of those are shown in the agenda. There have been some slight modifications, like the release of the RFP. It states here October 2015. It was December 2015. We're currently in our discussions with Department of Technology. We're currently finalizing the project schedule, taking into account how we're trying to be as efficient as possible and getting a system to the business as soon as possible, but also needing to have appropriate timeframes for their work with regards to procurement or federal reviews, et cetera. So we're currently working to solidify that, and I'm hoping to have that approved soon.
So there could potentially be some additional adjustments to
Yes.
this timeline I see on page 7 of the agenda.
Yes, ma'am. What I can give you is, right now, contract execution, I'm looking at winter. Whether that December, January, I'm still working with the
Got it.
Department of Technology.
Got it, but that just gives me a sense of how far down they'll be pushed.
Yes.
So can you give me a general idea, season's work, for the project closeout?
Pardon me real quick. I need to put my glasses back on.
Because currently it says December of 18.
So we'd be looking at early summer of 18.
Got it.
Okay.
Okay.
Are there any questions by chance?
I have none, finance or LAO. Any public comment on issue 1? Seeing none, I'm going to temporarily hold the item open until Senator Monning returns, and then we'll take action on this item. Okay?
Thank you.
Thank you. All right. We're cooking with grease. Item 5180, Department of Social Services. And we're going to begin with the overview of CalWorks, my favorite thing. Then we'll move on to CalLearn, Housing Support Program, Early Engagement.
Thank you, Chair Mitchell, and I'm just going to turn it over to Todd Bland, our Deputy Director for Welfare to Work Services.
Perfect, thank you. Is this the PowerPoint we're going to see?
Yes, Madam Chair, that is, actually, we're not going to do a PowerPoint, we're going to do just one slide from that.
Got it.
That when we get to that in a moment.
Got it.
Again, I'm Todd Bland, Deputy Director with the Welfare to Work Division at CDSS. Pleasure to be here with you today. Your staff in their agenda and in our pre-hearing asked for me to give you an overview. I'll try to do that relatively quickly. I will try to walk through some of the sheets in the handout while I'm doing that. Starting on page 1 of the handout, that is an overview of CalWorks. CalWorks is California's version of the federal Temporary Assistance for Needy Families program. It provides welfare to work services and income maintenance to low-income families with children. Federal funding comes in the form of a block grant, and federal funding is conditioned on certain rules, especially the most significant for us being the federal work participation rate requirement. Currently, there are about 500,000 families on CalWorks in 2015-16, and about 1 million children in those families. Some of the most recent changes that we've made in the program are shown at the bottom of that first page of the handout under the program enhancements. Some of those include the 24-month time clock during which clients are free to focus on barrier removal and other activities and not necessarily meet the higher federal participation mandate. Investments in enhanced subsidized employment, family stabilization, the online CalWorks appraisal tool, and housing support. These come up later in the agenda, so we'll talk more in detail about them then. On page 2 of your handout, I have 2 tables for you. The first is just a very high-level overview of the funding of the program, about $5.4 billion in 2015-16, broken down between federal block grant money, maintenance of effort, and other funds. Call your attention to the second table in the handout, essentially roughly breaking down the overall caseload, showing essentially 3 broad components. The first component being the cases where we have an aided adult, a work-eligible adult. Those cases with the aided adults are about 51%, or about 274,000. We call that the welfare to work group because ultimately we're hoping all of those clients can get through their barriers and succeed in welfare to work. We also have cases that are child only, and that group is about 33% of the caseload, or 174,000. And then finally, and again, this relates to that work participation rate, California has done a move-out strategy, and we pay for certain cases with non-MOE funds. By doing that, they are not part of the federal work participation rate calculation, and those are the long-term sanction and what we call the safety net. California, unlike most states, has a commitment to continuing to aid children even when their parents reach the 48-month time limit. So it's an
That's separate from the child-only cases, okay.
That is separate from that, yes. With respect to case loan trends, CalWorks is a cyclical program. I don't really have a chart on this for you. But what I would say is during times of recession, the CalWorks caseload has increased. During times of recovery, it decreases. Most recently, it peaked in June of 2011 at about 600,000 cases and has fallen to about 500,000 as of the end of the last calendar year. Most of that is due to the improving economy. I am going to take a moment, and there is a chart at the back, but I'm not going to ask you to flip to it, about the work participation rate, although it is, I believe it's the very last page, and the way I organized this could have maybe done a little better, but I'm just going to say that, take a moment, that the federal requirement is that we need to be at 50%, and California did not meet that rate in 2008, 9, 10, 11, 12, and 13. For 2008, 9, and 10, we did submit a corrective compliance plan that said we would get into compliance during 2015, and preliminary data from the Administration for Children and Families that we processed with them indicates that we have reached a rate of 55%. And I wanted to take a moment.
Now sleep at night.
Yes, that is, I am sleeping, actually not sleeping a lot better, but on that issue, I am sleeping a lot better.
Okay, good.
And I think it's worth taking a moment to commend the hard work of our clients in being able to engage with our program and engage in the activities that are federally accountable, our counties in administering that program, and the staff at CDSS who oversees it. It was a difficult task. It is and it's an ongoing task because the base rate of people actually participating is around 35%. Through those other strategies of the WINS program, putting certain cases in and move out strategies, we're able to get to the 55, but those strategies may not be available in a welfare reform environment. And now the main thing I'd like to talk about, and I don't think we have this choreographed very well, I'm actually going to jump over there for a moment and see if I can make the exhibit show up.
We can turn that mic on and you can stay there if you want.